Very honored to have you here with us because actually Dr. Chen is our former Minister of Environment Protection. He is an expert in this field. So I will give you a brief introduction about why we want to become environment-friendly hospitals and how can we do that. First of all, a brief background about healthcare and the environment, and then what are the global actions, and then how healthcare facilities can become more environment friendly. And lastly, voice from Taiwan, yes we can. Regarding healthcare and environment, I think everyone knows that we are living on a favored planet, and in this year, WHO Europe stated that there are these side effects on climate change and health. First, warming of the global climate is unequivocal. 这个全球暖化其实是非常明显不争的事实啊。And man-made greenhouse gas emissions, particularly from the burning of fossil fuels, are warming the earth, and health effects are already observed. The life of thousands of people may be threatened by more frequent extreme weather events. And the climate change affects some of the most fundamental prerequisites of health, for example, food, water, and air. Shifts in the distribution and behavior of insect and bird species are early signs, and that's the signs that biological systems are already responding to climate change. Public health security may be at risk. Climate change will affect everybody, but not everybody is equally vulnerable. And climate change will have adverse effects on economic growth too. And why healthcare facilities? Because we generate hazardous and non-hazardous waste, air emissions and wastewater. Also, we rank actually second only to manufacturing facilities in electricity usage per square foot. And we must comply with a growing number of increasingly complex regulations. So we need to learn how to comply with these, especially environmental regulations. And we can actually, with technical support, although we have very high density emissions, but we can also strive to proactively minimize these pollutions while increasing the quality of care, reducing risk, and also saving money. And these are why healthcare is so much related with CO2 emissions, overcrowded emergency room, and the use of electricity. This is in the operation room, and this is the, everyone knows that, right? Okay, I don't have to describe it. And this is the laboratory. This is the ICU, right? Everywhere, very high density of service, very high density of electricity, and very high production of waste. So under this situation, we can take three different roles. For example, we can take a reactive role by learning to identify and handle health problems caused by climate change. We sit there and some patients will come, they are harmed by the climate change. At least we should learn how to identify these patients and react to it. That's the least role. And then perhaps we can play an active advocating role for environmental friendliness by credible voice. And the best thing is that we can play also a proactive role by collective action to reverse the impact from a harm doer to a harm remover and a health promoter. And then we can change the situation from lose-lose-lose to win-win-win in both financially, socially, and also in health aspects. We can reduce harm by reducing environmental harm. We can add health services through the saved cost, and we can add health gain when we are doing these environment-friendly constructions, operations, purchasing, and behaviors. So the global actions. In 1992, UN released the UN Framework Convention on Climate Change. And in 2009, in the UN COP15 for Climate Change Conference in Copenhagen, it actually said that international agreements and financing mechanisms should promote ecological sustainability and public health by supporting climate change mitigation by the health sector throughout the world. So it mentioned that not only every department should do something to mitigate climate change problem, but also they emphasize the health sector should do something, and the other agreements and mechanisms should support health sector to do these things. And the calls from the WHO in 2008, in the 61st WHA, there's a speech from the Director General Margaret Chan. She said that climate change is already one of the 3 most important challenges to public health. And then in the resolution on climate change and health, there are 5 things they urge member states to take action of. And one among it is to strengthen the capacity of health systems for monitoring and minimizing the public health impacts of climate change. And the other very important one is to promote effective engagement of the health sector and its collaboration with all related sectors. And that is why we are here. Health sector is here, and the other sectors are also here. We are going to work together. Later you will have a speech from our energy Bureau of Energy, and then you will also have speech from the Agency of Environmental Protection. So we are doing the collaborating efforts. And in 2008, WHO, together with the NGO Healthcare Without Harm, published Healthy Hospitals, Healthy Planet, Healthy People. And this is the very important document to address healthcare facilities' impact and also our opportunity to help lead the fight against the climate change. And we have actually 2 experts from Healthcare Without Harm tomorrow to give us their experiences. Okay, and in 2009, WHO representatives attended a seminar in World Medical Association, and the representatives point out that WHO has a role in facilitating collaboration to put health first. And WHO's goal is to reduce global burden of disease linked to environmental exposure by 25%. And WHO, it also mentioned that WHO has developed strategies to achieve climate-friendly hospitals. And WHO will work with NGOs, including International Network of Health Promoting Hospitals. So we also have directors from the collaborating centers on health promotion in hospitals. So in 2009, WHO contacted with the International Network of Health Promoting Hospitals and Health Services. And then early in this year, we established, I'm also a member of this network. So early in this year, we also, Taiwan, we have the support from Tzu organization, and we established the task force on health promoting hospitals and environment. And there are 5 tasks of this task force. First is to visualize environment-related health promotion issues in existing HPH models and tools, which will be introduced tomorrow by Professor Han Townsend. And the second task is to give examples on best evidence practice, which will be presented by Pendle and many of including Taiwan's hospitals and Singapore's hospitals. And the third task is to develop tools for monitoring the effect of environment-friendly intervention programs. This is something we are also doing now. And then to disseminate the best practice examples, and also to establish a database for environmental-friendly hospitals and health services program. And there are many other efforts in other countries. For example, in US, early in 2002, the American Hospital Association had the society, the American Society for Healthcare Engineering, and they published the first tool for sustainable design for healthcare sector, which is the Green Healthcare Construction Guidance Statement. And then it was developed to 2 volumes for Green Guide for Healthcare, one for construction and one for operation. And I believe that our expert from Healthcare Without Harm, Dr. Peter Orris, will introduce some of the contents tomorrow. So also the Practice Green Guide also provides some calculation tool for energy impact for member hospitals, and the SHE also has their energy benchmarking using Energy Star Portfolio Manager. We hope that Taiwan in the future we can also have our champion, our benchmarks. And in UK, they actually set a very ambitious goal to a 60% reduction in CO2 emissions from 1990 levels by 2050. So in England and Wales, hospitals will reduce primary energy consumption by 15% from 2000 levels by 2010. And in Scotland, hospitals commit to a 2% reduction of energy consumption per year. And NHS has a good corporate citizenship assessment model now, and this was also introduced by British Medical Journal just last week. So also in Canada, in Australia, many similar efforts. So although most of you are already members of health promoting hospitals, some of you are not. So what is a health promoting hospital and health service? It is an organization that aims to improve health gain for its stakeholders by developing structures, cultures, decisions, and processes. And a health promoting hospital has several stakeholders. We need to take care of our patients. We also have to take care of our staff. We also take care of community population. And at the same time, we hope we can also take care of the environment and our planet. So this is the task force I mentioned, the task force on health promoting hospitals and environment. I'm the chair of this task force, and we signed the agreement with the Secretariat of the International Network of Health Promoting Hospitals. And these are the terms of references. And these are the task force members. Most of them are here. For example, as I mentioned, Professor Henton Lawson, Professor Jürgen Pelikan, me, and we have one official representative from WHO, Mrs. Susan Wilburn, and we have Dr. Gary Cohen, the co-executive director and also one of the founders of Healthcare Without Harm. And we have representatives from hospitals. For example, Dr. Michael Wang from Alexander Hospital, which is a Singapore hospital. And we have Dr. Jindong Li, the CEO of Tsuji Medical Mission. And also lately we have Professor Jürgen Pelikan also join us. So how healthcare facilities can become more environment friendly? There are 2 dimensions. One dimension is that we can work upon 7 elements of a climate-friendly hospital. And how do we work on these 7 elements? We do it through organizational learning and action. So this is from an environmental management system. And here are the 7 elements of a climate-friendly hospital. This is is described in details in Healthy Hospitals, Healthy Planet, and Healthy People. And I have the Chinese translation of these 7 elements in your handout, okay? And the hospital can take organizational effort to change your operation and constructions. In addition to that, there are support from global level and from national level. And then at the individual level, of course, we health professionals also need to do something altogether with our hospitals or to advocate for these efforts if your organization is not has not noticed this problem. Okay, so regarding international global level, I already mentioned it earlier, and then at the national level, tomorrow morning our Minister Yang will also attend this conference. So we are committed to do something for you, right? To support you. So one thing is to strengthen public and policymaker awareness. The second is to prioritize primary health care and pursue disease prevention strategies, because, you know, less diseases end up to less utilization of these high density services. And then we should also develop national plans of action to reduce the health sector's contribution to climate change, and also to identify, support, and publicize healthcare facilities and healthcare organizations when you work to reduce your climate footprint. So that is also something we are doing here. And then we also should foster cross-disciplinary partnerships to ensure wide-ranging and effective mitigation and adaptation. And also we should ensure that the role of the health sector, health sector can play is reflected in the broader national positions. So for hospitals and health systems, here briefly, we can educate our hospital staff to take action, and we can review we need to review our facility procurement practices and patronize local vendors who carry sustainable products and follow sustainable practices whenever possible. 就是绿色采购, okay? And we also need to audit, measure, monitor, and reduce our climate footprint. And we need to identify potential co-benefits, because we are not only paying effort and attention to do it, we actually can gain health from it, and we also have financial gain through, you know, the saving of our cost. And we should also educate accreditation bodies to honor your effort and then take actions in the, you know, upon the 7 elements. Okay, and for every health professional, we should encourage our facility to lead by example and adopt measures to reduce our climate footprint. And we should encourage professional associations to explore and address this issue. And we should also work with the associations to make a climate literacy a mandatory requirement in our, you know, educational curriculum, and to become an informed advocate for climate mitigation and adaptation efforts. And also we ourselves should set an example. So, you know, regarding transportation, someone told me that there is the double BMW new transportation. The first B is bike, second B is bus, M is metro, W is walking. Okay, so we can set an example. We, you know, doing something for ourselves. And then regarding the environmental management system, this is a scheme adopted from the ISO 14001 organization. Their framework, there are several key elements. For example, management, commitment, and environmental policy, planning, implementation and operation, checking and corrective actions, management review. Many of you are very familiar to that, right? The first level is the leadership, and then PDCA, right? And then review, okay? So, and there are also some management tasks in response to these key elements. So we need to have visions and policies, to have strategy and plans, to have organization and resources, to have performance and procedures, to have measurement and reporting, and to have evaluation and improvement processes. And then we should also implement performance measurement on management system, on compliance, on performance, and management reviews. So you have the handout. I'm not going into these details. And in brief, there are 7 steps to implement organizational learning and actions. First is to commit, and then to plan, and then to do, to check, to improve, to disseminate, and to sustain. So finally, the voice from Taiwan is that we want to build a change we want to see in the world. And we have been participating in doing a lot of things. For example, we participate in the Global Task Force on Health Promotion Hospitals and Environment. And we now have Taiwan's Task Force on Health Promoting Hospitals and Environment. And we already held a workshop on this issue in September. And then we called for partnership. Now we already got 128 partners to reduce 164 tons by the year 2020. And we demonstrate national commitment. This is supposed to be led by the president tomorrow. And now we have the 2010 International Conference, right? And then in 2012, the International Conference